Umberto, you can start.
Okay, welcome to everybody. We are excited to have this third webinar focusing on the Ukraine battlefield. We want to discuss what happened in this theater for people that are so stressful, exposed to trauma of war. We want to discuss the impact of war for mental illness and the eating disorder. We have to learn from colleagues that work in this kind of theater because they are exposed to the stressful situation, and they also learn for us what we can do to manage to care people, their family. And we have to remember also that in a so polarized world where there are so aggressivity spread around, all the people, not only who live in Ukraine now, but all the people that live in the other side where there are battle, where there are war, where there are other risky situation, they feel themselves not so safe, and so they need to be helped to maintain the equilibrium, their mental health. And also for the people that don't live in this kind of situation, you have to remember that nowadays there are more than 50 wars around the world nowadays. And yesterday there are the release from the World Health Organization speaking about the war on Sudan, on the south of Sudan, where there are more than 200,000 people dead for the consequences of these drugs. We want also to think about how families and how young people around Europe, because even if they aren't exposed directly to the war, they are day by day exposed to the consequences of the wars on the social, on the news, on the TV, all the time. Social trauma affects not only people on the battlefields. And so we have all to mentalize, to help to mentalize this situation. We had two other webinars on this kind of topic before. The first was on Israel situation, and there was a presentation by Michael Hazon. The second was on the Middle East, and there were two presenters, Karine Elkazen and Dr. Jaber. And now there we speak about Ukraine situation, and there shall Olga Sushko, our presenters. We don't blame what happened on the theater. We have to maintain ourselves in the professional attitude. We want to underline that neither the Academy, neither the European chapter take a position on the underlying conflicts. We want to help people, to help them to suffer less and to share more, if we can, peace around the world, around ourselves. I am very great to Olga Sushko. She's a clinical psychologist. She's a schema therapist. She's co-founder of the Ukrainian Association of Eating Disorder, and she is head of the eating disorder treatment units based in Kyiv, named B Center. Thanks, Olga, to stay with us, and it's your time. Thank Olga.
Yes, thank you, Umberto, for introducing me. I will share my screen now. And I have to, oops, I don't know what you can see now. I hope you see my screen. Is it?
Sorry,
yeah?
sorry, I don't remember to say that everybody can pose question. You can write, and we collect the question, the comments, and we pose to her, this question to Olga after her presentation. Sorry, Olga.
No problem. So yes, thanks again for having me today, for inviting me to share my perspective and understanding of how the war in Ukraine impacts people in the context of the eating disorders. I'm going to scroll down because this is the PDF, not the PowerPoint presentation. So this is our program for today. I have to say that today I'm going to talk about my personal experience, the experiences of my colleagues from different parts of the country, and also those who now live and work outside Ukraine, as I do. I live in the Netherlands right now. And I'm also going to refer to some history because we will touch on the topic of epigenetics just slightly. Unfortunately, I cannot share a lot of data today because even before the war, there was so little research on the EDE population in my country, and now for several reasons, it is not possible to collect data, and it is not a priority, to be honest. However, recently in May, we had our meeting of our Eating Disorder Association, and we were discussing the processes, and I can share some ideas and some aspects of what we have discussed with you today. So I want to start with an obvious fact that the war is ugly and it is terrifying, and the war takes away the sense of safety, and it takes away the sense of predictability of the world. Even though we all here know that the world cannot offer any safety and predictability to any of us, we still really need to experience this, we expect this, to feel that we have some control over the chaotic reality. So to be honest, we need to maintain this illusion of being safe in a predictable circumstances, and the war ruins this. And this experience is so profound and so shocking that it can't hardly be put into words, and it's unlikely to be understood by someone who didn't experience that. And the bad news is that, in my opinion, this experience doesn't go anywhere, at least until the war is still there. And I'm not sure whether it will disappear when the war ends. So when people face circumstances like this, they need coping mechanisms to deal with the new external and new internal reality. I have to mention here that as a clinical psychologist, maybe like some of you, I partially see the eating disorders as a coping mechanisms, and I want to acknowledge their important function of self-regulation when there are no alternatives. So I will start here with adolescents because they, as the polls show, are the most vulnerable group among all Ukrainian population now. Some research found that 32% of adolescents in Ukraine were screened positive for moderate or severe depression, 17.9% for moderate or severe anxiety, and around 35% for clinically relevant psychological trauma, and up to 30% for eating disorders, which is actually very important for us today. And what I notice now is that the attempts to control weight, control the body, is not driven by fashion, but it's more driven by a feeling of uncertainty. I would like to refer here to Francesca Perplotchikova. This is also a Ukrainian psychologist, psychotherapist. She's a founder and author of the DBT-C method, DBT for children, pre-adolescent, highly sensitive pre-adolescent children, which often develop psychopathology. She mentions three main domains of life that are crucial for a developing child: a sense of self-love, a sense of safety, and a sense of belonging. I won't dwell into self-love today, although this is a very interesting topic. So if you're interested in this, you can Google it and read about it more. But the sense of safety and sense of belonging are crucial if we are talking about the war consequences and psychopathology. So let's have a look on these numbers. This number, when the war began, we were offered a huge amount of help from all over the world, and trainings were conducted for us, including colleagues from Israel, the US, and the other countries who have experience working with war trauma. However, the war in Ukraine has many differences from situation in other countries, including cultural aspects, the huge front line, and the size of the population. Now we have different data showing that around 30 million of people are temporarily displaced, and we have approximately 7 million people fled abroad, and the rest had to move within the country. So this is a huge forced migration. Now let's have a look on different groups of children and adolescents from Ukraine now. We have those who have immigrated. Here we have mostly, a lot of actually separated families. And as someone who works with these kids now in the Netherlands, I can see that the younger the child is, the easier the adaptation and assimilation goes. And adolescents, they struggle the most. They are losing relationships with friends. They isolate themselves. We see a lot of self-harm, depression, anxiety, eating disorders, and basically a lot of them just want to go back home. They don't want to live in Europe or somewhere else. We also have TDP. This is a temporary displaced people, temporary displaced kids, because Ukraine is a really big country with a lot of cultural differences between our eastern and western parts, southern regions. So basically, people who are moving within the country, they also face a lot of difficulties and immigration issues. We have a group of kids who are living in the war zone, and of course, they experience a lot of severe trauma, anxiety, and the fact that it can be said about all the groups of kids, but the parents are absent. I will say a little bit more about this later on. And we also have a group of kids, a big group that are living in relatively safe regions. They are, of course, kids hear the sounds of anti-aircraft defenses, explosions at nights, and they often unable to attend school due to air raids. So this is not the safe region in Ukraine now. This is not about safety, basically. So as you can imagine, for a different group of these children, the loss of sense of safety and sense of belonging is very visible. And a sense of belonging is a connection to peers, other social groups, and also to a family. And this is also a very obvious fact that the war keeps the parents really busy. So kids and adolescents have to deal with life on their own, whether they live in Ukraine or abroad. I have a story about a 12-year-old boy from Kharkiv region who has parents, but because of the war, because they are military, they are always somewhere. And I remember my grandmother telling me a story of how she lost parents at the age of 16 and had to immediately become a grown-up. So now we have the same situation. We have some kids that have to live a life of a grown-up, even though their parents are still alive. So in a world full of chaos and unsafety and unpredictability, for some people, the need for having some certainty shows up as an attempt to restrict their food intake or to have at least some rules, some schedule, some plan for tomorrow. If we're talking about adolescents, here are the main problems that we face now. We have a problem with healthcare accessibility in Ukraine and abroad. Abroad, we have a big problem with the language, of course, because Ukrainians usually, well, some of them speak sometimes English, but a lot of people don't. And not in every country you can use English as a language to communicate with the mental health care system. And of course, you all know that in a lot of European countries, you have a long waiting list. In Ukraine, we don't usually have waiting list. You can directly go to the doctor if you need one. And within Ukraine, before the war, we had a very active community of professionals working with the eating disorders. We had specialized departments that were opened in hospitals. And now my experience and my opinion is that we have rolled back, as some doctors have gone abroad and some have switched to working with PTSD, and hospitalization in the hospital in the eastern part of Ukraine is simply dangerous. It's not possible. So we also have problem that there is a lack of support for families, because people don't always know where to look for help, and because of the immigration, they lose social contacts. And of course, the problem of comorbidities, because there's been always a problem in the treatment of the eating disorders. Now, if you remember the numbers, more children and adolescents will have the comorbid disorders. The numbers from the previous slides, I mean. Let's now talk about the adult population of Ukraine, and I would like here to begin with a little bit of history, because it is really important if we're talking about the eating disorders and trauma in Ukraine. As some of you may know, in 30s of the last centuries, the population of Ukraine experienced a famine called Holodomor, which took 4 million lives approximately. I won't dive deep into epigenetics today, as I'm not an expert on the subject, but we know that through DNA methylation, cells themselves put tags on their DNA that turn genes on or off for minutes or years. In children, at the stage of intrauterine development, such marks form some features of adult life. So during these periods, we are very sensitive to environmental factors. This is called epigenetic programming. And there are studies of people who experienced a Dutch famine in 1944, or the famine in China. They found marks on the genes that led to development of obesity and diabetes. And some studies were also conducted on the Ukrainian population. And data on more than 20,000 people born between 13 and 39 in different Ukrainian regions show that among those who were caught by hunger during fetal development, many decades later, there were more diabetes than in other regions. There is an opinion that the mother's low-calorie diet before and during pregnancy set in motion a program, the accumulation of deficit calories that continued to work after the famine ended and led to obesity and then to diabetes. I would say not from the research, but from my personal observation that in Ukraine we've been tending to overeat. I'm now able to compare two cultures, the Dutch one and the Ukrainian one. And this is very interesting fact. In the Netherlands, which also lived quite poorly and had a famine in 1944, it is not acceptable to waste products. So one of my wonderful colleagues and friends told me that in some families, if you invited to visit, you will be asked exactly how many potatoes to cook for you. And you will not get more than this specific amount. In Ukraine, we have traditionally quite opposite story. My mother was afraid, for example, to go visit her mother-in-law in the village because they always cooked a lot. And you were basically not allowed to leave the table if you didn't finish everything. So a couple of times I conducted a group for patients with overeating, and I've got a lot of stories about rules, about food and eating. Actually, a lot of people of my age were raised by grandparents because our parents had to work, and many of them experienced the trauma related to eating, for example, force feeding, because older generation was so afraid of famine. So when the war began, people ran to the stores and bought everything on the shelves, which I think is pretty expected behavior. Later, in a state of acute stress, people could not eat, and then they began to overeat as a way to calm down and comfort themselves. Now, many of my clients who never experienced any eating-related problems say that they gain weight and cannot do anything about it. Here, I would like to just a little bit touch this topic because this is really important. This is a new group of Ukrainians who survived torture, captivity or the war-related sexual abuse. They experience post-traumatic stress disorder. And of course, they have, a lot of them have the symptoms of eating disorders as well. We don't, I mean the professionals who work with eating disorders, we don't work with this population. They are getting treatment from the professionals, psychiatrists, psychotherapists who work with PTSD, basically. But I just wanted to show you that this is a totally new group of people who, some of them survived starvation as well. Some of them, this is not necessarily yes, but some of them did that. So we have this new group of patients who develop eating disorder symptoms due to PTSD. So I'm gonna stop here with describing the population and the groups who suffer from eating disorders now. And I wanted to share with you a case of my client and maybe share a little bit of hope, because this is a good example of how not processed trauma can affect someone's life. So this is a 40-year-old woman. She decided to begin her therapy due to atypical anorexia nervosa Persian type. And when we began our work, she had normal weight, some subjective overeating episode, followed by a Persian episode. She had a kid, a son, and she was tend to work a lot. So kind of a workaholic person. So when we dived into her history, she described that she was raised by a grandmother, and the grandmother was what we call a Second World War child. So she also had Jewish roots, and in Soviet Union, this was really difficult for people with Jewish roots to achieve some stuff. Sometimes they couldn't even get to enter the university. So she needed to hide the fact that she is Jew and Jewish, and she even had to change her name. And because of all these difficulties she faced, she got her own understanding of how you can survive and what skills you need to have to be successful. And she directly transferred all this knowledge to my client, which was a kid at this moment, and she was really sensitive and really compliant child. So there were a lot of beliefs that my client absorbed very early in her childhood that supported her eating disorder. And the most damaging beliefs were first one is that you have to be prepared to the war. You always have to be prepared. And in order to be prepared, you have to be ensured that you know how, that you can always work hard, sleep less, and be able not to eat. So she basically started not to eat very early in her life. And the second damaging belief, core belief, was that you have to always be the best at what you're doing, but not too visible. So that was also kind of a trap for her. So she had several episodes of burnout at work, a lot of interpersonal difficulties, a chronic eating disorder, etc. And by the age of 38, my client really worked hard to prepare to the war. And when we started therapy in 2028, we started working really hard on how not to be prepared to the war. And the opposite, actually, we started to learn how to eat, how to be relaxed, how to get some rest, etc. And it wasn't going very well, to be honest. I mean, it was a slow process, and then the war began. So this is really, that was a really ironic in a way. I started this presentation with the statement that the war is ugly and terrifying, and this is still true and still relevant. And at the same time, I can see how on the level, on the personal experience and the individual life, how the experience of the war can bring some compassion, kindness, and feeling of being united with other people, and knowing what is important and what is not. And so the war is ugly and terrifying, and at the same time, it brought recovery to my client, together with psychotherapy, of course, because she actually realized how her grandmother was wrong. Because actually, in order to survive, you have to know how to be compassionate to yourself, how to take care of yourself, how to eat and sleep properly. And actually, you cannot make it if you're constantly stressed and exhausted. So my point here is if we're talking about the war experience, the ability to process it is crucial. The ability to process the trauma is crucial, and I would say that our current needs are not only the healthcare system accessibility, both in Ukraine and abroad, but the psychological support for adults, for adolescents, like more psychologists that really understand what is going on, how to help these children or how to help these adults. More social support, I would say. This is the way how we can prevent our next generation from having all these post-traumatic way of thinking, way of coping. Yes, so I think that's it. I'm gonna stop here. This is my email if you have any thoughts later on, or if you want to connect, please do. I will stop my presentation here.
Perfect, Olga. Your presentation is very exciting. It's very impressive. You talk about many aspects that perhaps we need to reflect together, to use the time to reflect together. Everybody can write inside the chat. Me, I was impressed and I posed to you some question, but also there are Lia Manzato here. I don't know if Lia Manzato can talk directly or not, because she's member of the European chapter board. Usually she followed this kind of webinar, co-conducting it with me. And so, Emilia Manzato, if you want to talk, you can. There are a question now. Thank you for your bright presentation and sharing information about Holodomor with the colleagues. The war is ugly and terrifying and sometimes bring recovery to eating disorder patient. Is this the only case in your practice, or are there more spontaneous recoveries of eating disorders? What are the main factors that influence, according to your opinion, surely? Everybody, when we talk, we speak about its opinion. And so your opinion, Olga.
Thank you, Marina. I appreciate this question. This is not the only case. It was just why I wanted to present this one in particular, because it is related to the previous war we had. So how it transferred this experience, how it transferred through the generations of people. And I cannot agree that it was spontaneous, because we worked really hard on this recovery, and the patient is still working hard because she doesn't have any eating disorder problems, but she still works a lot. And she now has to take care of her son and other relatives. I mean, in my opinion, if we're talking about the factors of influence, I think the support is crucial. And my clients, they use a lot of support from people who already are recovered from the eating disorder. So the chance to talk to them, the chance to discuss fears, doubts, etc. This is really important, and it really helps. Psychotherapy helps a lot, but unfortunately, not everyone can afford this for many reasons.
And Emilia Manzato asks you, which is the difference between before war and after war on eating disorder epidemiology?
How was the ED's web? Sorry, I probably don't get the question.
So perhaps when before war, and how has the war changed it?
Oh,
What is the change in the number of people, in the phenomenology and in the epidemiology, the differences?
I think that yes, actually the polls show that we have more people with eating disorders. At least the screenings show that. I don't know how we can properly evaluate these numbers, but the polls are what we have at the moment. Yeah, there are some changes, like the new populations, like the what I described in the presentation, people who were captured or who were lived under the occupation or who experienced sexual abuse. This is a new, like before the war, we only had some cases from time to time, but this is now a huge group of people who needs to be treated properly. And yes, I think that now adolescents, they show more of the restrictive eating behavior in order to control their lives, in order to control themselves. They still, of course, are stuck in TikTok and Instagram and all this social media, and they still see a lot of beautification, I would say. But now, in my experience, yes, it is more driven by the uncertainty and fear and the fact that they lost a sense of safety.
The number of people affected by severe depression or eating disorder are very high between adolescents, you said, till 8% they are affected by it. but people there discuss how we can change the healthcare system, because it's impossible to imagine that 8% can be treated in the private, like in private session.
Yes. Well, support groups works, I think. It's an option. The problem is that because of migration, people have changed their place of residence, and it's not so easy to find the support group. So I think it will take time. But I don't know how it works in different countries around Europe, but I work in a Dutch organization that actually helps Ukrainians to overcome stress and trauma and other symptoms because of the war. So I see a lot of adolescents and adults who suffer from different symptoms here.
And so there are the differences inside the organization of the units.
What do you mean?
There are some organizative change in your practice, in your service, on the units that you know.
Yes, of course.
And do you engage also people without specialization, or all the people that work inside the unit are specialized?
They are all psychologists.
Okay.
That's it.
And so you haven't people that are with what we name expert by experience.
Yes, exactly.
US or not? I haven't understood.
Yes, we do. Yeah, of course. Do we have any other comments?
Speaking, well, another question that we are talking together practically.
Yes.
No, I just pose some question on discussing to you. It's very interesting for me, because I try to understand what we can do as professionals inside a so difficult theater. Speaking about
You know what? I can share one idea, because what we did when the war began, we got a huge support from Ireland. There are colleagues from the one of the Irish clinics that provides compassion-focused therapy, and they offered groups for young adolescents with anorexia nervosa and their parents. So we had this program. It was pretty short but really helpful. So we had this trainer who provided the training for the kids and adolescents and adults, the parents, and we had a translator who helped them to understand what she's talking about. And it was a lot of support in the beginning.
that is important, surely. You need perhaps also again, or not?
Sorry?
You need also again, perhaps, or not, if there are somebody that want to help you in some
Yes,
way.
that is always welcomed. So we have the association, we have a Facebook page, a lot of people read us, and they can actually get this information from us and see that, okay, we have this support group or that support group, or we have a training on how to, I don't know.
And many people use the English, or you use other language.
We usually, if we have some training in English or other language, we usually translate it, because people want to understand that.
You spoke at some times during your presentation that there are between a child and a young adolescent the sense of self-love, the sense of safety, the sense of belonging. And so this is the attachment basis under attack now.
Yes, exactly. And for the adolescents who had to move somewhere, this is a really strong stressor, because they are in the process of forming the identity, and they are stuck. in this. They
And
have.
there are some courses for mothers to help them to improve the quality of the relation with their child.
Well, we are trying to do this, and I do this in the Netherlands for parents, the courses for parents. But the problem is that the parents are awfully stressed. So they're also like they're in new circumstances. They have to work mostly when people are immigrants, and so they need to find the job under their qualification. So the parents are also not capable of doing their everyday jobs as a parents. So if I'm talking about my Dutch focus and my Dutch experience, I'm working more with parents, not with kids. But I work with parents, so they were stabilized a little bit and they could help their children to adjust to this new reality.
In some ways, if you help parents to become more quiet, more safe, they transmit their condition to their child, and so indirectly you treat also the child. No? There's another question by Emilia Manzato. Because of eating disorder during the war are more linked with trauma, how do you face this?
Mm-hmm. So usually it depends on what trauma we have, because if we are talking about the military who was in the war zone, he will be or she will be treated in a special unit at the hospital with she will be hospitalized if it's a severe post-traumatic stress disorder. And I think the treatment of the eating disorder will be the last step in the treatment program. We have now, because of the war, we have now a lot of professionals who are doing EMDR and other specific treatments for the acute trauma or PTSD. So, and we have really beautiful teams in hospitals, in psychiatric units who treat these kind of patients. In private practice, I usually treat people who were not so severely traumatized. So, for example, someone saw one event or was a part of one, I don't know, accident. Because if it's more, severe, then this is about psychiatry, the drugs, and hospitalization, I guess.
And because your patient are ongoing level of trauma, how do you adjust your treatment to try and take into account it? About the different level of severity of trauma?
You know, this is my probably expertise is that I'm not a normal eating disorder professional. I mean, I don't use, for example, only CBT for eating disorders. I was trained as a schema therapist, so I used to work, I've been working with complex PTSD and comorbid patients. And I was trained as an EMDR professional as well. So I combine everything I have. And the biggest problem is actually to make this conceptualization, and we still learn how to do that because it's really hard. It's really complex cases. And you never know where to, the problem is you never know where to begin and what to address in the beginning. So now I think in these circumstances, the expertise of the psychologist, psychotherapist, they has to be really profound and really, you have to know a lot about trauma, both childhood trauma and acute acute adulthood trauma or PTSD.
And do you have some connection with the psychiatric services or with some psychiatrists?
Sure. We always have that because in this center, we've been treating patients with anorexia nervosa for years. So we have the good connections with the psychiatric units. And if we need someone to be hospitalized, it is always possible. But now, yes, that also what I covered in this presentation is that we have less people who want to work with eating disorder, because the eating disorder work was kind of a luxury of a normal life. And now we have the war and we have to focus on the trauma, and a lot of professionals, they moved to the trauma work, and what is absolutely okay. I'm fine with that. It is what has to be done. But our eating disorder patients, they are a little bit I wouldn't say abandoned, but yes, we have less professionals who are willing to develop in this field right now because the priorities are different.
That is clear. And there are also some professionals affected by burnout or by trauma. And in this case, what do you, on your service, do for them?
A lot of professionals are affected, and a lot of professionals experience burnouts.
And so in this case, what do you do? What the units, what the headquarters, the general direction of the mental health system do for them?
The general direction is a recommendation to go and take some time, take care of yourself, and make some space for yourself, because you cannot actually help anyone if you're burned out. Some of them, I know some professionals who stopped working as a psychologist because they cannot do it anymore, because they was too involved in the beginning. And but some recovers, and you survived one burnout, then another one, then the third one, and yeah, you just learn something, and you learn how to stop at the moment, at some moments, and you continue doing what you're doing.
Yeah, in war, everybody is at least in some way at risk, I imagine, or not. Or there are someone that can sleep well.
You mean, well, people who live abroad, they are mostly, I would say they are more depressed, but they are more, they get enough sleep. Usually they can eat, they can do basic stuff like sports or basic care. People who live in Ukraine, this is really stressful because of the air raids, and this is really hard for people to wake up in the morning and continue like their routine.
Some answer before you said that because there are so many people affected by mental illness and eating disorder that you can use group therapy. What kind of group therapy? What kind of group therapy do you use?
Well, it's more about support groups, to the ability to
It
share.
focus on trauma, or the treat also it is specifically eating disorder?
Now this is more focused on trauma, but I know also about the groups that are working with us, people who have eating disorders. So we use both approaches. It depends on what kind of experience this person had and what the needs are.
But to manage this group, you use some therapeutic model, or is a supportive group?
It's both. We have the group EMDR in the psychiatric units for those who experience severe trauma, and I know that people do a lot of stabilization work there with these people. For those who have eating disorders, that can be a CBT, that can be just support group, or some, I don't know, psychodynamic groups as well.
In the presentation, I said, because you was one of the founder of the Ukraine Professional Eating Disorder Association unit, you can say something about this kind of organization, how many people, what they are, who they are.
Yes, yes, of course. So the association, it was founded in 2015. Now we have, I'm not sure about the specific number. Maybe we have, if you have here Marina Fateyeva, she's my colleague from the association, maybe she can write in the chat how many people we have now, but I think it's around 300 people, 300 members. And this is the organization which encourages not only psychologists to join but the 400, she says. Well, it is, yeah, we have a lot.
Around 400.
Yeah. So we have medical doctors, we have psychiatrists, we have psychotherapists, psychologists, we have nutritionists in the organization, dietologists, and other professionals. Like we have gynecologists. So everyone who is somehow interested in these fields are welcomed. So we have once a year a gathering or a conference, so we can discuss stuff and share the experience. We just had it in May. And we usually invite someone from abroad. So it would be an international conference, so we could discuss like what is going on in the world, not only in Ukraine.
So welcome inside the European chapter.
Yes. Thank you.
Speaking
We have to arrange that. Yeah.
Speaking about the case that you present, why this man was so furious? Because she isn't only anorectic, she is also an aggressive mother, she is also workaholic.
Why?
There's some factor, there's some basic factor for her to arrive to present herself in this way of
Yes, of course, because of the I would say because of hypersensitivity, and of course she has the temperamental factors, but temperamental factors, they won't show up without the environment. So we always see the combination of what was there,
Sure, as usual, there's a combination of factors, but it's curious that she is, briefly, if I understood well, a bad mother, a workaholic, an anorectic, in burnout.
No, she's a good mother.
Depressed.
She's a good mother, really good mother.
Really good mother. Okay, I understood. Finally, you're really good mother. If she hasn't time to follow her child, she's a good mother.
No, you mean I think that I mentioned her parents that were absent in her life. That's why she was raised by a grandmother.
Okay.
Yeah, but that was very common in Ukraine. I was also sometimes put down to my grandmother's for 3 months because we have a very long summer holidays in Ukraine. Usually we have 3 months of summer holidays, and parents have to work. So children, what do children do? They go to grandmother, and
okay, they serve. Grandfather, grandmother serve for something in this
yes.
game.
Well,
Okay. Thanks a lot, Olga. Your presentation was very interesting, doing amazing work under tough condition. I think we need to take a step back and get politicians to sit around the table and end the wars to stop these problems they cause, whether in Ukraine, in Palestine, or in Sudan, or in the other part of the world. Surely we need more peace in this so aggressive period. Thanks a lot.
yes.
Okay, we talk also for this, to exchange, to unify professionals, to improve our capacity to face this kind of very risky condition, and so to help people to stay well that we can. Thanks a lot, Olga. Thanks to everybody. It's a very interesting webinar, and you can find it on demand inside the website of the European chapter. Thanks to you, and thanks to Don Ganno, our support that help us in every passages. Thanks to everybody.
you
Good
for
evening. Ciao. See you again.
Bye.
Olga. See you again.